Hello, I am Dr. Elizabeth Zhang, and I am an ophthalmologist and oculoplastic specialist. And today I'm going to talk about the cornea and corneal abrasions, as well as corneal erosion syndrome. So this is a diagram of the eye right here. And this is the cornea. The cornea is the clear part of the eye that is above the colored part of the eye. This is the colored part of the eye, the iris. This is a cross section through the eye. This is the lens of the eye. This is the inside of the eye. The outside is the sclera. There is the conjunctiva, which is the clear tissue over the sclera. That's this tissue here. And in the back of the eye is the retina. And out here is the optic nerve. In this diagram, here is a cutout of the cross-section of the cornea, and here's the cornea blown up. And the cornea has different layers. So this is the epithelial layer, which is the topmost layer. Then there's a layer called Bowman's layer, followed by the stroma. That's the thickest part of the cornea. And in the back, there's Descemet's membrane and the endothelium. So corneal erosions occur when the epithelium is eroded away. And actually, that's also what a corneal abrasion is. So what happens with the corneal abrasion is that if you scratch the eye with some object, this often happens with baby fingernails getting too close to mama or daddy's eyes, or could happen for a number of reasons. Basically, what happens is some of the epithelium gets scraped away. And then that leads to the nerves underneath the epithelium getting exposed, and that's why it is so painful when that happens. The epithelium luckily grows back really quickly. In fact, even if you scraped off all the epithelium on the entire surface of the eye, for most people within a week, it will completely grow back. However, once it grows back, like once you have one layer of epithelium back, then the pain will go away. And so that's why a corneal abrasion, the pain usually only lasts for 1 or 2 days. That's the time it takes the epithelium to heal. But if you notice in this drawing, there are actually multiple layers of epithelial cells, 3 to 5 layers. And that epithelium does have to reorganize and rearrange in order to get back to normal. And there are some studies that show that it can take up to 6 months for the epithelium to get all the way back to normal. You can actually think of the epithelium having, kind of like little roots into the deeper layers in order to stay put. And so once you've had a corneal abrasion, if you rub your eyes, you are more likely to get another corneal abrasion because those epithelial cells haven't completely healed in a way such that they're really strongly adherent and will stay put. So you can kind of end up causing yourself another abrasion. So with a corneal erosion, what happens is the eyelid covers the eye while you're sleeping. And when you wake up, your eyelids open, and sometimes the epithelium might actually stick to the inside of the eyelid and pull away a little bit of the epithelium of the cornea. And this is why if you have corneal erosion syndrome, you wake up and your eye hurts for a little while, and then maybe an hour or 2 hours or half a day later, it feels fine again because the epithelium has recovered and has covered up that spot again. But then this can happen again. And so it can happen again and again because the epithelium, while it's growing back, again, hasn't gotten back to its completely normal state where it is completely adherent to the cells next to it. So what you can do to treat that is use some ointment like Gentile gel, Refresh PM, Lacrolube, in order to put a layer between your cornea and epithelial cells and your eyelid. So hopefully that tells you a little bit more about what a corneal abrasion is and what a corneal erosion is, and will help you understand what's going on with your eye. If you like these videos, please subscribe. I love bringing you this information. If you are in Cleveland, Ohio, and are looking for an eye doctor, come look me up. My website is www.dreyelid.com. Thank you.